Hey friends, let's jump right in. You got it. Normal saline at 75 mils an hour is questionable. The client has heart failure, which is the inability of the heart to pump effectively, specifically that left ventricle. So if the left ventricle is not able to adequately pump blood from that ventricle to the aorta throughout the rest of the body, it's going to back up into the lungs. Now, once that fluid is in the lungs, it's going to increase the blood pressure. It's going to increase the workload on the heart. Remember, you need volume and resistance to create pressure. The more volume you have, the more pressure you're going to have. Furthermore, this client is already exhibiting signs and symptoms of pulmonary edema, hence the foamy, frothy, pink tinge productive cough. Now, when fluid sits in the lung fields over time, bacteria likes warm, moist places. You will see clients with heart failure will develop pneumonia. Now, this client is already code strokish. We do not want to exacerbate the pulmonary edema, and we definitely want to question that order. Okay, moving on. Metoprolol 12.5 milligrams. Now, we know that metoprolol is a cardioselective beta 1 blocker. Remember, beta 1, you have one heart, beta 2, you have two lungs. Although this medication is used for hypertension, which our client has, it's also used for chest pain, angina, heart failure, and arrhythmias. However, it will slow down the heart rate and make it easier for the heart to pump blood, but we're going to question it in this client because as we can see, the heart rate is already 30 beats per minute. Metoprolol, beta blockers, they all end in LOL. They are contraindicated in clients with third-degree heart block. They're also contraindicated in clients with bradycardia, hypotension, and decompensated heart failure. So we're definitely going to question that metoprolol because that heart rate will go from 30, 20, 10, night, night. Okay. Now, we're going to question morphine only because this client is not complaining of pain. We always think cardiac patients, morphine. No, client is not complaining of pain. We also know that morphine causes vasodilation, so it could lower the blood pressure, which they need a little help. However, it can cause bradycardia and syncope. So not even indicated, the client is not complaining of pain, and we're concerned about the bradycardia. Now, let's look at the chest x-ray and ABG stat. Yes, we need chest x-ray and we need ABGs because of the pulmonary edema concern. We want to be looking to see if there were any pulmonary infiltrates, and we would also want the ABGs to determine the pH, the CO2, the O2. We need to know our acid-base balance level right now, and it's going to drive which oxygen delivery device we're going to utilize. All right. Now, although this client needs oxygen, a non-rebreather is questionable because the client has a history of COPD. Now, remember, in clients with COPD, if we flood them with oxygen, it's going to decrease their respiratory drive and they're going to be struggling to breathe. Now, in a non-rebreather, it has one-way valves and that reservoir bag is holding oxygen, O2, right? And so we want to avoid that. The Thoracic Society, recommends we start with Venturi at 28% and 4 liters per minute, or Venturi mask at 24% and 2 to 4 liters per minute, um, to maintain O2 sats of 88 to 92%. They also recommend if their SpO2 is below 88%, our client is 84%, that we start with the nasal cannula, 2 to 6 liters max, and we can also do a simple face mask at 5 liters max. However, if we're going to use a non-rebreather, they recommend drawing ABGs every 30 to 60 minutes because we want to avoid CO2 narcosis and hypercapnic respiratory failure. We want to be monitoring that pH and those CO2 levels. If we see a progressive increase, the client may need non-invasive ventilation or mechanical ventilation, which we want to avoid because those lungs are going to be stiff, non-compliant, and it's going to be harder to oxygenate that client using a mechanical ventilator. So awesome job, guys. Stay tuned for more. Drop your comments, questions, concerns below. And until next time, have a blessed day.